All right, I will, before I introduce myself, I want to start with questions, actually. I want to ask you all a question. So who's a student in the room? Awesome. Who's a B school student or a master's level student? All right, you can put your hands down. And who's an undergrad? Good job. Great. For the students or for anyone, I'm going to pick on a couple people, or feel free to offer. I'm curious what entrepreneurship means in one word. So can someone just throw out a word? What does entrepreneurship mean?
Self-motivated.
Okay.
Innovative.
Okay, risk, innovative. Anything else? One more.
Go-getter.
Go-getter. Love it. Okay. I'm glad you guys point that out. And the reason I asked this question is that, briefly on my background, I went here for undergrad. I went here for medical school. I'm still here for residency training at Boston Medical Center and Boston Children's in the combined PEDS program. So I'm a third-year resident. So I've been here, and I've seen the culture here, and I've seen the culture have a duality to it. On the one hand, there's very much a culture of a lot of the words we use on stage. IPO, payout, monetize, commercialize. That's one language. That's one lexicon. But community service center down the street, actually, I don't even know where it is anymore. Somewhere, I think it might have moved. Right, there's a different language, and it's a language of social impact. It's a language of inequities, disparities. My focus on business models is on the opportunity we have now to combine those two languages and make my investors a lot of money, and at the same time eliminate a lot of health disparities. And Affordable Care Act is a big catalyst for that. There's policy instruments and legislation that preceded that allows for federal and state level dollars to drive some very interesting financial incentives, particularly for payers. In some cases, even device can make money here, and pharma. And so I challenge you all, and I'd love to know maybe after this panel what you are all interested in doing, whether it's going to consult or start a company or go in academia, but do something before you go into academia, or invest, whatever it might be. Just think of the opportunity you have to make someone or yourselves a lot of money, probably someone else, because entrepreneurs don't make money for the most part, but make someone else a lot of money and at the same time have a very meaningful impact. In terms of specifics of business models, so my company is called Care at Hand, not carrot hands, the vegetables, Care at Hand, which we we clearly are not, like, this is a first-time company, so branding was... I started this company the week before match for residency, which is suboptimal timing. I did intern year full-time, which hurt a little bit. And then since then, I've been part-time. Every other month, I'm protected from clinical duties. And the time I'm on clinical duties, I try to be post-call as much as I can during the week. So I'm still pretty much a full-time CEO. I stress that to point out that, again, I'm just now starting to pay myself again because I haven't paid myself for a year. So you're not going to make money being an entrepreneur. So don't, even though Polina, and I pitched Polina before, I respect Polina a lot. They did not fund us. That's okay. Yet. 300,000 left if you want to participate.
What's the pre-money?
We can, I think one of my investors is in the room. We'll talk about that. No, but the point here is that it is all about passion. And if you're truly motivated to do something, it's easy to be motivated in healthcare, right? Because I'm sure all of us have been impacted by someone in poor health in our families or otherwise. But in terms of the actual business model, so Care at Hand is a software platform. Most notably, it's an app that goes in the hands of a home care worker, specifically a lay caregiver. So this is someone that currently helps with activities of daily living for elderly that have some kind of functional decline. And I think Dr. Hughes is in the audience, but one of my med school mentors was here, I learned in medical school, activities of daily living are the things that we learn when we're 2 years old, and then things that we learn or unlearn as we get older. Unlearning activities of daily living is not a criteria or indication for hospitalization, or it shouldn't be, even though oftentimes is. Home care workers can prevent that. So home care workers, on average, are $10 to $15 an hour workers and are a lot cheaper than nursing homes. That's why insurance companies like them, because it's an inexpensive way to keep patients out of very expensive nursing homes. The problem is that home care workers are, not to dehumanize them, but a very unsophisticated sensor. They don't collect very meaningful clinical data. And all our technology does is translates what they collect into clinically meaningful data, and they serve as an early warning system for health decline. So a care manager gets an alert. We could talk about how that happens 5 to 10 days before a patient is about to go downhill or go to the hospital. That's 5 to 10 extra days that my company offers an insurance company to prevent a hospitalization. So we save them a lot of money. We've got some interesting data about how we can reduce 30-day readmissions by 43%. We now have revenue, which is exciting, brand new. I'm excited to say we just cracked $100,000 in revenue. And again, for the investor in the room, if you're here, I haven't updated you, so I'm sorry. So the challenge in business models there is that we're not selling to just one customer or one end user. We have 3 end users: the insurance company, the home care agency that they reimburse to provide home care services, and then the home care worker that actually provides the home care services. The insurance company pays me, but I have to figure out a way to create value at all 3 levels. So although there's an amazing opportunity to have social impact and be a social entrepreneur, there is a lot more pressure to be creative with business model creation. And if nothing else, I'd love to leave you all with kind of a homework, I guess. Oh my God, homework. I haven't thought about that in a long time.
Excellent.
With homework. If you don't know what design thinking is, look it up. I have, maybe our B school or school management has it, but Stanford has a lot of open source stuff, all right? Look up design thinking. Look up what it means to empathize, to ideate, to prototype, to test. That is what I do every day, and that's how I am able to make money and create social impact in this weird, very complex business model. Other thing you should know, lean startup. It's become very sexy now. Eric Ries is on the cover of Inc., and he's all the rage. He's all the rage for a reason. If you don't know what lean startup is, look it up. Eric Ries, Steve Blank, some of our folks here. Agile development, if you're not a developer, that's okay. You should still know what that means, because you need to know how to do customer and product development, or at least you need to know what product development is if you're going to do the sales and learning from your customers. So that's your homework as well. And then the final thing is identify what your passion is. I think that's probably the most challenging business model there, because I have a lot of friends who make a lot of money. And they're my age. I'm 29, and I don't make any money. My wife is the breadwinner, thank God. But there are a lot of my friends that at 29 and 30, they went into PE, they went into IB, and all the fun acronyms that make money. And a lot of them are very happy, but those few figured out that was their passion, whatever about numbers, or it floats their boat. A lot of them are not happy, and one of them actually. Not that he's not happy, but Ross Fleck, he's a friend of mine. We had a radio show here together, whatever. He gave a talk here actually a few weeks ago about his experiences, and he was telling me how he's trying to find meaning in his work. And I would encourage you to just find that passion, and once you figure out what that passion is, you can make a lot of money doing it. It doesn't have to be eliminating social disparities. It can just be making money if that's your passion. So, which is also good. Quick thing, just so you guys know, Hacking Pediatrics, there's a hackathon that's starting at 6 p.m. tonight. If anybody wants to participate, come with me on my bicycle, riding over there. Boston Children's is hosting it, along with Hacking Medicine, so you look into that. And I guess, what are your, I'd love to, my question to you all, what's your passion? How are you going to change the world and make a ton of money? For someone else, maybe. Anyone? passion? Yes.
Thank you. My name is Joanne. I'm not a BU student. I'm actually one of the few quote-unquote professionals in this room. And I say quote-unquote because I left the community health centers, hospitals, state government, and pharma jobs that I had over the last 10 years to join 3 colleagues to start up our own small business. We are passionate about improving health outcomes. We all have Masters in Public Health or MPA degrees. And our tagline is we work on passion and not on commission. And so I'm so grateful for the comments that you made today. I like to think that our passion is what's going to fuel us, but being self-funded, the passion is not sustainable over time. So this conference is very appropriate for me to attend as an individual, but also as a business partner in this venture. So thank you to the 4 of you and all our previous panelists for opening my eyes and fueling me to continue the work that I'm doing.
Great. Just make sure you're, this is something that Bev Brown pointed out to me that I've always believed but never had a good quote for. Nonprofit is not a business model. It's a tax status, something along those lines. Making money is excellent because it is a mechanism for scale. And the problem with a lot of my friends who are running very successful nonprofits is that there were actually business models there that could have scaled much larger had they taken a for-profit approach. If they took a for-profit approach, realized there isn't the investment interest or commercial value, you can always drop back to nonprofit and do the brand equity play or whatever the play is for nonprofit. But all the skills I described, design thinking, lean startup thinking, they take you through a accounting process of what's the biggest risk to scale. And then if you go through all those eliminating risk steps and you find that I really can't do this through a for-profit approach, there's always nonprofit. I'm not saying you guys are nonprofit or for-profit, but that smells of something that someone would do for nonprofit, but with Medicaid expansion, with Section 3026, 2037, and we can talk about all the ACA sections that are going to directly fund what you're doing. There's money to be made from commercial payers, Pharma Plus, device that's about to go out of business and looking to do a Hail Mary. A lot of money.